Evening everyone, welcome to your first Sunday session. So last week you were doing some voting on the Instagram story as to kind of which topic you would like to see first in terms of the revision blast videos, and overwhelmingly for paper one we tended to feel least confident with psychopathology, and so that's where I'm going to start this evening. It's just going to be a quick whistle-stop tour through the topic. So first of all, pinpointing what booklets are involved with that topic, what information falls within that, and what basically you need to know. So it's a good starting point to watch this video, do a little bit of a RAG rating on how confident you feel, and then that should give you an indication of where you need to prioritise your revision, whether that be doing practice questions on these topics, doing some kind of summarising, mind maps, flashcards, testing yourself on the material, going away and doing things like Kahoots and Buckets. I'm going to be putting some links this evening and kind of at different points throughout the week on electronic resources for psychopathology. And of course, I'll keep doing the Monday to Friday 5-a-day questions and chuck some of this in as well. So as a little bit of a starting point, you can see I've mapped out just in terms of bullet points, you can kind of see there, what the different areas are for this paper one topic. So I'm just going to kind of talk you through each section very briefly, and then if there's any questions, I'll leave that open in the comments below, and you can post or send me a direct message. So if we start off with booklet one, first of all, this is definitions of abnormality. Now, the key thing to remember with definitions is that it is a definition. It's just about labelling abnormal behaviour. So the first booklet here is not actually trying to explain why people are abnormal. It's looking at different examples of ways in which people get labelled or stigmatised as abnormal and the strengths and weaknesses of using those labels. So you tend to find that in booklet one there's a lot of shared weaknesses between these definitions, things like it being culturally relative, ignoring the role of context, lacking temporal validity because norms change over time. But also there are some benefits to these definitions, that being that they often lay the groundwork for diagnosis. So booklet one is very general about mental health. So you've got the 4 definitions of abnormality that are labelled on the spec, and what that means is anything that I'm going to talk about now that is named, that means you need to know it. So if it's a researcher's name or the name of a theory or a definition or a key word, if it is on the specification, that means you could get asked a direct question on it. So you need to be familiar with the language because that could be a barrier to you accessing the question or not. So rumba is very important. So for booklet one, you've got deviation from social norms. The word deviation means to move away from an accepted standard. So deviation from social norms is not adhering to those unwritten rules in society. Failure to function adequately, so thinking about what it means to be kind of a functioning member of society, being able to do daily tasks like getting up, getting dressed, going to work. If not, if your behaviour is very maladaptive and it starts to impact your daily routine, you would be said to be functioning inadequately. You've got statistical infrequency, so that is about your behaviour being unusual or rare or uncommon statistically within the population. So things, for example, like having extremely high IQ, that would be classified as abnormal, even though it's a desirable characteristic, and that's one of the weaknesses of that definition. If you fall at the extreme ends of the population, your characteristic is deemed to be abnormal. And then lastly, you've got deviation from ideal mental health. Now that definition is a little bit different in that instead of presenting a criteria for abnormality, Jehoda in that definition said, here's the 6 things you need to be normal, and therefore not having one of those criteria is what would make you abnormal. So that's about the absence of well-being. So if you remember the acronym Some Say I'm Abnormal Myths, referring to self-actualization, resistance from stress, having identity, a strong sense of autonomy, an accurate perception of reality and mastery of the environment, even just missing one of those criteria would make you abnormal according to that definition. So booklet 1, you need to know the criteria for all of the definitions. You need to be able to provide an example of a mental health condition that would be classified as abnormal using that. So for example, for deviation from social norms, you can use the example of Tourette's syndrome, because swearing in public, although wouldn't be something somebody could help, it would deviate from that unwritten rule of swearing in public. So that definition would call you abnormal. And of course, as always, the evaluation points, the pros and cons of using those. As we move on to the rest of the topics, so booklets 2, 3 and 4, these are where we look in depth at specific mental health disorders. So we've got phobias, depression and OCD. And for each of those 3 booklets, you need to know the characteristics, so what are the symptoms and the diagnostic criteria for that disorder. You need to know an explanation and you need to know a treatment. Now, for each of the 3 disorders, what the specification does is it gets us to look at them in a different way of thinking. So, for example, booklet 2, phobias, we use the behavioural approach to explaining and treating phobias. So we have to put ourselves in the perspective of a behavioural psychologist and think, how could this behaviour be learned? In what ways would the disorder have come about? And also, in what ways could it be treated using behaviourist principles? That doesn't mean that's the only explanation for phobias, but for the exam, it's the only one you need to know. So for the characteristics, I've just bullet pointed it there. For all 3 of these disorders, so booklets 2, 3 and 4, you have to know the behavioural, emotional and cognitive characteristics. So that is referring to behavioural, how do people act, emotional, how do people feel, and cognitive, how is the patient thinking. So for example, for phobias, behavioural characteristics are things like panic and avoidance, whereas emotions might be a feeling of anxiety, because a phobia is a type of anxiety disorder. So you need to know at least 2 examples for each of the 3 types of characteristics. For the explanation for phobias, it's the 2-process model, and that is worded on the specification, and therefore you have to use that language. But to simply put it, the 2-process model is classical and operant conditioning. It's what you already know from approaches and should be really confident with. It's just applying it to the context of this disorder. So we acquire the phobia, so you learn it through classical conditioning, so through association, and then you maintain that phobia through operant conditioning. So you're negatively reinforcing yourself to continue being scared by actively avoiding the situation that makes you anxious. With the therapies for phobias, there's 2 different ones. There's a gradual one and an immediate exposure one. Gradual is systematic desensitisation, and once you've used that key term in full once, you can abbreviate it to SD afterwards, to just make sure you show that knowledge and then save yourself time after. So that's about creating the anxiety hierarchy and kind of building up gradually. Whereas flooding is immediately exposing the patient to show them that, first of all, they can't be in a state of relaxation and calm alongside fear. So eventually they're going to have to be calm in the presence of that phobic object. And then it creates that counter conditioning, that new association, so they no longer feel fear in the presence of the object. So you've got 2 very different, very opposing therapies, but both of which are based on the idea that if we learnt this phobia, surely we can unlearn it. So key tip for, well, kind of all booklets really, when you're evaluating the theory, so when you're evaluating the explanation of the behaviour, we refer to the normal adds or questions validity in the conclusions of our evaluation points. But when we're evaluating the treatments of disorders, we should be referring to the effectiveness and the appropriateness. That's a little top tip. If we then compare that to depression, so again, you would start off by making sure you had knowledge of what depression is. So it's a mood disorder. It can come in many forms, so bipolar, unipolar, things like MDD, so manic depressive disorder. Being familiar with the characteristics. So again, 2 examples for behavioural, emotional and cognitive. And then you've got the explanations and treatments. So for depression, it's based on the cognitive approach. So therefore, the explanations and treatments are about thinking and about faulty thinking. So there's 2 main researchers named for this booklet, Ellis and Beck. Ellis said that it's down to irrational thoughts and came up with the ABC model. So the idea that we have an activating event, something happens in your life, we have a set of beliefs about that, and then the consequence is our behaviour, so our reactions to that scenario. But it's only if we think irrationally that we behave irrationally, and that will manifest in the symptoms of depression. And then you've got Beck's negative triad. So that's in the name, it's negative thinking. So here, this is about negative views about the self, the world and the future, and how it creates that self-fulfilling prophecy that the way we think about ourselves impacts how we treat others, how they treat us, and it's that vicious cycle that's often quite difficult to break. In terms of the treatments, there's only one named treatment for depression, and that's a form of CBT called Rational Emotional Behavioural Therapy, so REBT. And REBT was developed by Ellis off the back of his ABC model, and this is about challenging irrational thoughts, trying to dispute that belief system, and then provide rational confrontation, so allowing patients to see why their thoughts are irrational and to challenge and change them. And then finally, on to booklet 4 of OCD. So we've had the behavioural explanation of phobias, the cognitive explanation of depression. We're now using our knowledge of biology and the biological approach. So the biological approach to OCD, again, includes characteristics. For the explanation, it's broken down into 2 main segments. You've got the genetic explanation, which includes looking at twin studies and concordance rates, and also candidate genes, so like the SERT gene, for example. And then you've got the neural explanation broken down into the role of neurochemistry, so looking at low levels of serotonin, and then looking at brain structure, so having high activity in the orbital frontal cortex. So you've got kind of 2 explanations for genetic, 2 points for neural, and then for your evaluations, there's a handful of IECs for each, and then a few evaluation points that work for the explanation as a whole. And then finally, the therapy is of course then based on biology. So because we've talked about neural in the explanation, we're going to look at drug therapy as a treatment for OCD. So that's where you can bring in your knowledge of synaptic transmission, and the role of SSRIs, so selective serotonin reuptake inhibitors. So obviously that's a bit of a whistle-stop tour through what is involved in the topic, with a few exam tips and hints thrown in there. I would definitely, after watching this video, obviously give it a like, give it a comment, and do yourself a little bit of a rag sheet just so you can see whereabouts you're at. And yeah, hopefully that's been useful as a good starting point. I'll put some votes on the story next week as to which kind of topic you want to see next for paper 1 and paper 2, and we can get some more Sunday sessions ready and raring to go. Thanks, guys.